this boy, Madari Somoimbani. He was born on 26th November 2017. Now, when he was born, when he was still a baby, you know, babies, when you are trying to lift them, when you are throwing him, just playing around with the baby, we noticed that breathing rate is too much, it's too high. So from there now, we said, this is not normal. When it was 2 years, we took him to Mamba Hospital. At Mamba Hospital, they referred us to Choma. From Choma, we are referred to UTH. When we went to UTH in 2020, everything was done, the echo was done, and at the end of the program, we are told that the boy has a hole in the heart. So they said the only medicine for this boy is just a surgery because the heart has a hole. Last year when I was on Facebook, when I was just browsing on Facebook, I saw this hospital, National Heart Hospital. So I liked the page. I started following what they are doing. I saw a lot of surgeries here and there. A lot of testimonies coming out. Yeah. From there, I made up my mind. I moved from home direct to this hospital. They explained to me that we have to cover up that hole and also have to enlarge the artery, the artery which is small. So they booked him for artery first, enlargement of the artery. That was yesterday. So yesterday he was taken to the theater and the enlargement of the artery was done successfully. He has been booked for a surgery now so that they fill up with the hole. When I explained to my friends and even to my family members, they said, no, this is not normal. It has never happened in our family. Where is this disease coming from? We have never experienced such a disease. It's our first time. So they said, maybe the boy is wished. So that was their conclusion, saying, no, let's take this boy for witch doctors. And they took him. Witch doctors. The mother took him to witch doctors. What made me to bring this child is because the mother believed that the child is witched. But me, I believed that it's not which can work. It is only the surgery which can make.
Today we are going to operate on a 7-year-old child who presented to us with an intracardiac condition called Tetralogy or Fallot. In short, we pronounce it TOF. It's an open heart surgery which we are going to conduct today. It's a multidisciplinary team composed of surgeons, anesthesiologists, perfusionists, and a set of nurses. Tetralogy of Fallot, or TOF, is a congenital heart condition. Usually, there is what we call a VSD inside the heart. A VSD is a hole, basically a hole, which causes blood from the left and the right to mix. So because of that mixing, one, there's a reduction in growth in the patient's milestones. They don't grow like other normal children. They may present with difficulties in breathing, and sometimes when they develop what we call chest spells, they may not even breathe properly. Sometimes they can even turn bluish. They need to squat for them to relieve themselves. And most times, maybe even in society, you've seen some children who turn bluish, and when they squat, they lean forward, the symptoms are relieved. Yes. So basically, in a nutshell, those are the usual symptoms of the condition called TOF. When all conditions are well, such surgeries we conduct usually when a child is about 6 months. Okay, we can conduct that surgery correct. But because certain conditions may not be met, we still operate on older children. Like today's child is 7 years old. So his condition is quite favorable. No wonder he is growing to that particular age at a weight of 17 kilograms. Ideally, it should be way more than that. But because of the condition, he has retarded growth. surgery that may take maybe 2, 3, or 4 hours. It involves a number of stages. We make the child sleep, we open the chest, we stop the heart, we connect the heart to the machine called heart-lung machine, and thereafter we initiate the operation. We will need to patch the components that are the lesions inside, and thereafter, once done, we will organize everything and then ensure that our surgery is a success, disconnect the patient from the heart-lung machine, and then take the ICU.
During surgery, I think our findings were matching to what we had seen during our imaging investigations. There was nothing unusual. We found what we expected. It was a surgery that took us about almost 4 hours as a team. It went well. After surgery, we took the patient to ICU. The patient was in the ICU for only 4 days. The body responded pretty well. After 4 days, we had removed all the indwelling lines and then we moved the patient back to the main ward. Today is the 8th day after operation. the patient is doing very fine, we should be able to discharge the patient home to join the family. In the case of Madaliso, before surgery, he was not able to cover about 100 meters without getting tired. But I have a report from the father that now he's able to get on the stairs without challenges. Yesterday they did a walk about 50 to 100 meters. The kid was able to walk excellent.
Around 18, a nurse came said the surgery is done and has been taken to the ICU. So maybe after 2 hours you can come and see him. So I went there. I find him still sleeping because he had put a tube inside. So you can't talk, but he could just open the eyes, but he can't say anything. After the tube was removed, I was called because he wanted water, and he said, "Where is Daddy?" I started talking to him. I felt very good. I felt very happy. I said, "Wow, he's now able to talk." Yes, and things really happened that the surgery went on well. So I was very happy. Yes. I was feeling a bit of, at first, getting worried, but after seeing him, I felt very, very happy. After the surgery, I explained to them that the surgery went on well, and the boy is talking. You can even talk to him. I even put the phone on out. They greeted him, "How are you?" He responded saying, "I'm fine." "How are you feeling?" So "I'm feeling okay." They are very happy and they are shocked. Now, just eager to go and see him. When are you coming? That's the next question now. Want to come and see the boy. How is he doing? So they have accepted also. They said the myth which they had that it can't happen. Now they have changed their mind, saying, really, it is happening in Zambia. We didn't know. But now we have known because it is coming from our family now that something has happened. And it is really happened.
Before, we could not conduct open heart surgery as Zambians. We depended on colleagues from outside to come and do such surgeries. But as of today, as I'm talking, we are conducting this life-saving surgery exclusively Zambians, without any foreigner coming to help. Bring your children for surgery. Let them benefit. Because as you go to our colleagues, the traditional healers, most of them, they are going to inflict pain by tattooing a child and introduce unknown substances in the body, which may actually worsen the condition and possibly lead to loss of life for a child. Bring the child or bring the adults to our facility. Let them benefit from the surgery that we are conducting here at National Heart Hospital in Chongwe.